How I approach the case is, this is how we have learned. That first understand what is very peculiar in the child, very prominent in the child. This has to fit into the medicine, not by theorizing. It should be a part of it, some way. So for me, what I would look is, I would look this into parents' history. So when we started looking, the child has this, some of the prominent aspects that we discussed. So I would immediately ask that mother's history during pregnancy is the most important. Sometimes it happens that the father's state and the child's state could also be similar. So in this case, I would ask, the child's nature resembles whom? You heard Dr. Divya also saying the same thing. So I would ask, the child's nature is like whom in the family? I'm not talking just by simple anger. It has to be a constitution wise. That constitutionally. So like his symptoms, his feelings, his cravings, his aversions, his thermal, at a state level. This is what we need to find out. So sometimes the parents say, oh, child is half like father, half like mother. So what we do is, we take mother's complete history and we take father's complete history. The reason I got late today, because the case lasted very long. I took father's history and I knew mother's state well, but still I took mother's history also, to make sure that we are on a right track. And what I would see is, those things which were very peculiar in the child, I would see the same, with the same prominence and the same peculiarity in one of the parent. And we'll see what was the result. And this time and again it has proved with excellent results that yes, it holds true. This is how I approach in a lot of cases. Make sure that the connection between the child and the father or the mother, it doesn't happen so commonly with father, but it does happen sometime. And it holds very true. But from this case, we learn a lot of things. Number one is how the remedy comes up in a denial. What we learned in Dr. Divya's seminar, a lot of it we have seen. And that this is true, we see it here again. The second thing is the minute observations in the parents, which help us in a child's case. Minute observation in the child and in the parents. What is ringworm miasm, how it comes up, how calcarea and sulph is an easy remedy for us. I'll give you one example. Just 10 days back, this child was there, again asthmatic child. Wow. And he was in class 10. So he dreams. We were giving him, the remedy we were giving him was calcarea nitricum. And then he was better and not better. And then he gets this dream. He gets a dream that there was an exam and he passes exam with very good marks. So there was nothing strange about it. So we asked him, what did you feel in the dream? So he says that in real life, there's a lot of competition in the class. So I said, what is it with the competition? So he says that in the dream, I could see that those friends with whom I have competition are also there in the dream. And in the dream, I got the best marks. And so the principal gives me a prize. So I said, what was that experience? So that he says that for me, what was important was that principal calls me there on the stage and he gives me a prize, that you got the best marks. And that all people are seeing me, and that was the feeling. This was exactly like the medal. This was exactly, see, I am the best. See, I am like this. And incidentally, the child also got calcarea sulph. But this is sulfur ego. Sulfur, which is a part of row 3, has a main issue to do with their I developed too much. That identity or that ego is with respect to either their knowledge or their looks or their achievement. I know the best. Oh, you don't know anything. There is extreme contempt. So that's sulfur. In India, what happens is we see a lot of family together. So, for example, I know that the mother, my mother's sister and and their mother, they all three need leg defloratum. But we take the history of all, we never take it for granted. We take the complete history, confirm every bit of it.
Do you find that unusual that all three in the same family would need the same remedy? Is that unusual?
It's not unusual.
Not?
It's an observation. It holds true. Sometimes it doesn't hold true. Sometimes they may not need the same medicine.
But all three of them, that's kind of, I think it's amazing.
No, it's not amazing. If you sit back and if you think of your family members, you will see this kind of connection running very well. Though it's not a kind of rule, but it does happen. And that's what even Dr. Divya mentioned. So